Hey everybody, Dr. Langston here. I want to talk about some shoulder issues that we see. A lot of times people will get that ability where they just they can't bring their shoulder up anymore. It doesn't necessarily mean you're old, it doesn't necessarily mean that it's just part of life. We call that frozen shoulder, or the clinical term is adhesive capsulitis. Usually what will happen is I'm working out, I'm lifting weights, I'm picking something up, and I feel some pain in my shoulder. So then what I do, I'm just gonna not use it for a week or two. That's how frozen shoulder starts, okay? So there's a little capsule, this fluid-filled sac that goes around the shoulder, and it kind of gets folded over. And when it gets folded over, if I don't use it too much, that's when those folds start to stick together. So if you have an issue where you're like, I can't get my shoulder up, that's frozen shoulder. Now, what happens if I just kind of have some pain in my shoulder because I went to pick something up? Get in the shower, get on the wall, just try to at least stretch out that capsule, bring that shoulder through that range of motion so you're at least preventing frozen shoulder from developing. A nice hot shower, like I said, kind of pull that arm up. We don't need to be lifting weights with it if it's sore or hurting, but at least try to get it through that range of motion. And of course, if you have some shoulder pain, anything more than a couple days, it's really worth talking to a trained professional. We treat shoulder problems all the time. So if it's an issue for you, don't let that shoulder freeze up. Give us a call, 618-667-8100. Have a good day.